And look, 2 weeks from today, a majority of students in Minnesota will be going back to school, and health experts are concerned about declining childhood vaccination rates.
Yes, new CDC data shows that fewer kindergartners are fully protected against diseases like, say, measles, we've talked about a lot, and then whooping cough as well. Our Barrett Leone is learning about an effort to change some of those states, meeting families where they're at. She joins us live from Edina.
Good morning. Yeah, we are in front of Children Minnesota's mobile vaccination clinic, and it's offering free vaccinations to children across the metro. It's traveling around the metro here, and I'm joined here this morning with Adrienne Thornton from Children's. Thanks for joining us this morning.
Thank you for having me.
Yeah, and we're talking about, that decline, because this is especially important because we're seeing a decline in vaccination rates. Can you tell me what you're seeing?
Yes, we're seeing fewer kids coming in to get vaccinated due to multiple reasons. Misinformation during COVID. People didn't bring their kids in because we were all at home. And so now we're trying to get those kids in, get them vaccinated, get them caught up, but also giving them the right information so they can make an informative decision. And so we're kind of battling different things at different levels, but especially with our elementary school kids, a lot of our younger families don't want to vaccinate. They feel like it's dangerous for their kids. They don't want all the vaccines at once, so they want to spread the schedule out. And so as a result, you have things like multiple measles outbreaks within a year in the state. And so we want to move past that and really make sure that we're providing the service that people need, where they need it, how they need it, but also educating them at the same time.
Yeah, and tell me how the mobile clinic is doing that.
So we have a generous grant from the United Health Foundation, which enables us to take it out and give the vaccines for free. There's no cost to anyone. We give vaccines just like we do in our clinics, but the big difference is they don't have to pay for it. And so it's a pretty quick process. We go through their vaccine record that they have now, and we determine which vaccines they need, and they get whatever they need that day. So it's a really great process.
Wonderful. Well, we're going to dig into this so much more later this morning. Thank you, Adrienne.
Yes.
So they are traveling again across the metro. We're in Edina right now, but their next event, August 27th in Columbia Heights. I'll send it back to you guys.
Thank you, Barrett.
Our Barrett Leone reporting in Edina with an important resource for families. We appreciate it, Barrett. Thank you. So we know kids getting ready to prepare to go to the state fair, but also after the state fair, kids are preparing to go back to the classroom. Parents are preparing too. And there's concern this morning about vaccination rates, especially as the school year gets closer.
Yeah, that's exactly why Children's Minnesota is rolling through the metro with a vaccination clinic. Yes, rolling through to help families. Our Barrett Leone is in Edina this morning to tell us more about the mobile program and what families need to know. Hi, Barrett.
All right, sounds like we're having some mic issues with Barrett here. Let's see if we can get this figured out here. There we go.
There we go.
We got it?
Can you hear us now?
There we go. There we got you now, yeah.
We got you. We got
Okay,
you.
fabulous. Good. We're on this mobile clinic. You saw the outside of the bus not too long ago. Really cool. Well, it's fully outfitted here. I mean, look at this here. And this is all to help kids get vaccinated before the school year. We've talked about, back to school shopping, all of that. Well, they need to be physically ready too. And to tell us more about it, we've got Adrienne Thornton with Children's Minnesota joining us. Thanks for waking up early.
Yeah, thank you for having me.
So tell me how this process works. How do kids get vaccinated here?
So we work with the school nurses at multiple schools in the Twin Cities to set up the clinics. They look at the school records, determine what kids need. They talk to the families to let them know, hey, you are behind on this, or you need to get caught up on this, or the clinic's going to be here, why don't you get this vaccine while they're here. We're doing back to school events, we're doing parent teacher conferences, and we'll be administering vaccines. They can either register or they can just walk up. We do it both ways. It's easier if they register so we know how many vaccines we need, but we bring an abundance of vaccines, so even if they just walk in, we will have what they need.
Good deal. And I know you'll be across the Twin Cities this summer, fall. And what I love about that is you're bringing immunity to the community. That's your slogan here. So tell me why that's important.
That's important because in order to protect the entire community, we really need to have a certain number of people vaccinated. And it's important for the kids because they're together all day long, every day. And so if one child gets sick with a vaccine preventable disease, now we're looking at an entire classroom being exposed, as well as their family members. If you have elderly at home or young infants at home, now they're at risk. And so by bringing immunity to the community, we're protecting everyone in the community, everyone in the family. And we will be offering influenza and COVID vaccines to the families once we have those in stock.
Okay, good deal. Thank you so much, Adrienne.
Yeah.
And I will send it back to you guys in the studio. We are in Edina right now. Next place the mobile clinic will be is in Columbia Heights.
Okay, perfect.
Immunity in the community. Barrett Leone, we appreciate that update from Edina. Thank you. So on your screen right now where the vaccine clinic will be for the rest of the month of August, as Barrett said, next stop going to be in Columbia Heights, the Family Center. That's on the 27th. On the 28th, you can find it in Little Canada at the elementary school. On the 29th, it'll be at Columbia Heights Middle School.
That's right. New CDC data shows fewer kindergartners are fully protected against diseases like measles. We always talk about that, and the whooping cough. So our Barrett Leone is learning about an effort to change some of those statistics, meeting families literally where they are at. You were inside of a really cool place, Barrett.
I am, yes. This is the Children's Minnesota Mobile Vaccine Clinic. And I'm in one of the exam rooms right now. And this is really neat because it's bringing immunity to the community. But I also want to just show you how massive this thing is. We've got one exam room right here, waiting room, administration services right here, and then we've got a whole nother exam room right here. So fully decked out with all the things to vaccinate kids at no cost. So to talk about this effort, I'm joined here this morning by Adrienne Thornton. Thank you for joining us this morning.
Thank you for having me.
And we are seeing a decline in rates.
We are.
So why is that?
A number of different things. Misinformation, younger parents feeling like they don't want to vaccinate their kids even though they are fully vaccinated, feeling like we're giving kids too many vaccines at once. And so what we're trying to do is get out into the community, provide education to really go against that misinformation and make sure our families have what they need to make an informed decision.
So what vaccines are you offering right now?
We are offering all of the childhood vaccines for elementary school kids. We will have a few for middle school kids, and I know it's hard for parents to know which vaccines those are. So our wonderful Tammy Swing in our ambulatory area has created this lovely schedule that is much easier to read and understand for families. And so we've done it by age so that families know by age which vaccine their kid needs when they need it. And then on the back, we include what the vaccine does, what diseases do they combat, so that families have the education they need, they have the right information, and then they can make really great decisions for their kids.
This is such a good tool because it does get confusing a little bit.
It does. And sometimes, you know, what we found out during our measles outbreak was that a lot of our families didn't know that MMR included measles. They just knew it as MMR. And so by having these diseases on the back, we're outlining what's included in each of the vaccines and which diseases they prevent.
Okay, and you are giving these out to families as they come in. Okay,
we are.
Can we find this online as well?
Not yet. We're working on getting it online. We just got it translated into 3 different languages, and so now we will work on having it available for everyone.
Great. Thank you so much, Adrienne.
Thank you.
And we'll be back in about a half hour showing you more about of the clinic, the mobile clinic itself. I'll send it back to you guys in studio. Next event, Columbia Heights.
You know, it's really important, too, the fact that you mentioned the language part. You know, that's a big portion, making sure that we reach out to meeting people where they are in the community.
Yeah.
And if that means making sure that we can translate into languages to make sure that more people have access to that information,
That's huge.
it's even better.
Okay.
Barrett Leone, live for us in
It's
Edina.
huge.
Barrett, thank you.
Okay, Barrett, if I didn't know any better, I think, oh, you're about to walk into a doctor's office.
Right, exactly. I wanted to show you the door because this is a bus, you guys. You step onto the bus and you are brought into this clinic, and it's a pretty large clinic too. We're joined here this morning by Adrienne Thornton with Children's Minnesota, and you're going to show us around a little bit because we've got 2 exam rooms. Take it away. Where are we going?
So this is our administrative area. We do all of our paperwork, greet our families in here, and then when you come in, we have a medication room where we have 2 medication fridges, and we set up all of our vaccines here. And then you have our lovely exam room. This is the bigger exam room because we do have a wheelchair lift. In the event that we have kids or family members who are in a wheelchair, we can get them on the clinic safely.
Yeah.
And so then we have our other exam room so we can direct kids to either room. We can fit 3 to 4 people in a family in each of the rooms, which is really nice.
And I mean, you really wouldn't know it was a bus until you're on this side.
Right.
You can see this is where the driver sits.
Yeah.
Okay, Adrian, you were telling me you've seen the need for this really just rise in the last few years. The bus has been around since 2019.
Yes.
Tell me about what you've noticed.
Well, we noticed during COVID that vaccination rates dropped significantly, especially in children. And when they started going back to school, the rates didn't increase at the same rate that they decreased. And so we're really trying to play catch up.
Yeah.
We're trying to get people caught up on their vaccines. We're also trying to educate our families because more families are not wanting to vaccinate their kids. And so just making sure they have the education that kind of counters that misinformation so they can make informed decisions for their kids.
One message for parents who are hesitant on the fence, what would that be?
Come talk to us.
Yeah.
Come have a conversation with us. Ask us questions. We will answer all of your questions to the best of our ability. We will give you information. We can give them resources. We can direct them to where they can find the science. Some parents really want to see the science. We can direct them to where they can find that information. So just come have a conversation with us and get to know us better.
Yeah. Thank you so much, Adrian. Really important topic as we get ready to head back to the classroom, kids gathering once again. They have events around the metro. They're taking this, rolling it out to different cities. The next one is in Columbia Heights on August 27th, but they've got events through October, guys.
Thank you so much, Barrett.